Why do doctors not understand CFS immunomodulatory therapies? Imagine trying to solve a puzzle where some pieces are missing or don't quite fit. That's often what doctors face when it comes to understanding how immunomodulatory therapies might help with chronic fatigue syndrome. This illness is incredibly complex, with symptoms that can vary widely from person to person. Some patients experience severe fatigue, cognitive issues, or pain, while others might have more neurological or gastrointestinal symptoms. Because of this diversity, pinpointing a single cause or effective treatment becomes very challenging. Research into chronic fatigue syndrome is still evolving. Although scientists have made progress, there are not enough large-scale clinical trials to establish clear treatment protocols. Most current guidelines focus on managing symptoms like sleep problems or pain rather than directly targeting the underlying immune issues. This means many doctors are working with limited evidence, which makes it harder to confidently recommend immunomodulatory therapies. Another factor is the immune system's variability among patients. Many with chronic fatigue syndrome show signs of immune activation, such as increased levels of pro-inflammatory cytokines. But these immune responses can differ greatly, so what might help one person could be ineffective or even harmful for another. This variability complicates the development of treatments that work universally. Emerging research points to potential targets like metformin, a drug used for diabetes, or molecules like interleukin-37 and rapamycin, which could modulate immune responses. However, these are still in experimental stages and need more validation through rigorous studies before they can be widely recommended. Without solid evidence, doctors tend to be cautious about using these therapies. A significant hurdle is the lack of standardized biomarkers, biological indicators that can help identify which patients might respond best to specific treatments. Without these markers, it's difficult to personalize therapies or predict outcomes accurately. Researchers are actively working to find reliable biomarkers, but this remains an ongoing challenge. Furthermore, understanding chronic fatigue syndrome requires an interdisciplinary approach. It involves not only immune factors but also metabolic, neurological, gastrointestinal, and hormonal systems. Integrating all these aspects into a cohesive treatment plan is complex and requires specialized knowledge, which many clinicians may not have yet. Education and awareness are also crucial. Many healthcare professionals are still learning about the latest research developments and potential therapies. Increasing awareness can help bridge the gap between scientific discoveries and clinical practice. In summary, the reason many doctors find it difficult to fully understand and implement immunomodulatory therapies for chronic fatigue syndrome is because the disease's complexity, variability among patients, limited research, and the absence of validated biomarkers all create significant hurdles. As research continues and more evidence becomes available, it is hoped that treatment approaches will become clearer and more effective. Always remember, individual experiences vary, so consulting healthcare professionals who stay updated on the latest science is essential for personalized care.